Rachel, welcome. And Karen, Karen, oh, Deirdre, welcome. And Eve, Florence, welcome everyone. So lovely to be in the space with you. Thank you. We're happy for you to be with us as well. Thanks, Florence. We've still got numbers going up, everyone, and we've got a huge amount of people signed on. But as you know, we'll be sending a recording as well. When Sandra and I booked this, we did a little omission on the different holidays. So we really appreciate also people being with us. Hey, Liz. Hey, Melissa. Hi, Sylvia. Welcome. Lovely to have you here. Welcome. Welcome, Deepak. welcome. Hello. Welcome. You might want to pop your video off at some point as well, otherwise you'll be on the screen with us the whole time.
That's fine. Happy to go off with you then. No worries.
So nice to see you. Welcome. One of our lovely contributors to the book, everyone. Hey, Michael. Welcome. Hi, Rosemary. Oh, welcome, everybody. We're just letting the last few people trickle in and we will get started in just a mo. Oh, hello, Daniela. So nice to have you here. Welcome. Hey, Lotta.
Hi.
Hello, welcome. Another one of our lovely contributors, everyone. You can pop your video off if you want. Yeah. Welcome. Hey, Diana. Welcome, Annette. Lovely to have you here. Hi, Francis. Oh, Angie, and we just caught up last night or the night before. Lovely to have you here. Welcome. Got people from all around the world. Oh, and Elizabeth from Canada. Just as I said, there's people around the world. Welcome. So lovely having you here. Welcome, everybody. Should probably get started, I imagine, then.
It's a nice round number. Well, it was 82 now.
Yeah.
So, yeah. Okay, well, shall I start off by kind of introducing myself and Jacob here, and perhaps I could hand over to you, Karen.
Perfect.
Brilliant. Okay, so thanks everyone for joining us tonight. Really thrilled to have everyone here for the launch of Trauma-Informed Healthcare by Dr. Karen Treisman. My name is Steve Jones, so I'm Karen's editor at Jessica Kingsley Publishers. We published the book, and we've worked together for quite a while now. I won't try and count the number of years, but we've worked across probably about 16 publications, I think, isn't it? So it's been quite a kind of an intense few years that we've been working together, and you can see some of the fruits of these labours sitting behind me on the shelves. Karen's been amazing in creating a really kind of stunning collection of books around trauma-informed working with children and adults as well, which spans kind of children's books through to professional resources and professional tools like practical cards. So it's been, yeah, a great kind of partnership over the years, and we're particularly excited about this new book that's publishing today, because this is the first one that we've really published that's targeting the healthcare sector. A lot of the books before have been kind of, broad or more universal or kind of more geared towards social care. So I thought for the format of today, we're going to be having some Q&As and some kind of questions, and then we'll have a section at the end for you guys to answer questions. We'll probably have half an hour of Q&A between myself and Karen, and then 15 minutes at the end for questions. Yeah, we'll crack on, and we'll try not to run over as well, because I know how important it is for people to have questions and how annoying it can be when there's only 2 minutes left at the end. So perhaps we could start off, Karen, if you could just introduce yourself and perhaps tell people a little bit about, the work that you've done to date, and then we can kind of start off with the questions about the book specifically.
Yeah, I'll try and keep it short. But yeah, just to give a sense, obviously my name's Karen. I'm a clinical psychologist. I work and focus particularly in areas of trauma, organizational health, relational, cultural, developmental trauma. I'm an organizational consultant to lots of different organizations, from schools, hospitals, lots of social care, prisons, around supporting them on their journey organisationally to become more trauma, adversity, culturally informed, infused and responsive. And so do lots of training, thinking spaces, assessments for court, obviously writing, as you said. So yeah, lots more bits, but I'll keep it fairly confined for those bits, but just to give you a little flavour.
Admirable job of keeping it concise there. That's very good.
I try. I mean, for people who don't know me and Steve, I often say our age-old thing is about me not being able to keep things concise. Hence why I end up with these huge mammoth books that weigh a kilo. So I'm trying.
Editor's prerogative, isn't it? We're always trying to cut things out. So the first question I have for you, Karen, is can you tell us a bit more about the inspiration and the reasoning behind writing the book, Trauma-Informed Healthcare?
Yeah. This book has been a bit of a different experience, I guess, as we were saying, for both me and you, because lots of my work is within fostering and adoption and child protection and child in need. And actually, health has been a huge passion of mine, but I've come at this book from lots of different angles, and it's quite an interesting story. So I'll give just a little flavour. Firstly, I have a lot of my own health conditions, chronic autoimmune health conditions. And so it's been a real passion project, and shared quite a lot of my own personal experiences with health in the book, as well as having a mum who has a diagnosis of multiple sclerosis and interfaces lots with health services, and lots of different friends and family going through health. My doctorate thesis was actually on HIV, and really looking at that. And recently, during COVID, I suffered quite a significant burn. So once again, experienced health services from a different perspective. And then obviously I've worked as a clinical psychologist within health services and within hospitals, from cleft lip and palate to burns to HIV, to psychiatric hospitals, and also have supported lots of people through having to go, supporting women who've been sexually abused to go for a smear test, or supporting people to interact with going through health services. But where this book kind of really came from was a few years ago, I'd gone and had a personal health appointment that I'd felt quite undignified and dehumanizing and powerless and silenced and voiceless. And I came back and I put a tweet, and I was absolutely overwhelmed with the response to this tweet of solidarity. And that night I couldn't sleep, and I thought, I need to do something about this. I need to write, I need to be a hopeful disruptor. I need to do social action. I want to write a paper on trauma-informed, trauma-inducing, trauma-reducing health experiences. So that night, I literally quite frantically popped something on Twitter saying, anyone interested in giving me some of your experiences of what went well, what was fab, what worked, what bits were harmful or thorny or painful. And in less than a week, I got just under 400 people who shared their experiences. And it was so moving and so powerful that I was like, wow. So I turned that into a paper. There was a huge response about, we want more, we need more. And so I basically ended up then wanting to turn it into a book. And the other little bit is my trauma-informed organization books are huge. And so I really wanted, as you're showing, they are, I think, 2 kilos in weight, volume 1 and volume 2. They're massive. And they still just scrape the surface. But I thought most doctors, nurses, dentists are not going to be delving in that level. So I want something that's more sort of concise and specific, that's much more tangible, accessible, tailor-made. So yeah, that's a little bit about sort of how the book started to develop and how we're here today, I guess.
And who are you writing for, Karen, with this book? Who are you hoping will pick it up?
Oh,
And what do you hope they'll get from it?
so I'm writing, it's actually already kind of landing in a way that I wasn't expecting. And that's the gorgeous thing sometimes about putting resources and putting them out there. And Sandra and I have been talking lots about that. The people I wrote it for predominantly was nurses, doctors, speech and language therapists, psychologists working in hospital, dentists, midwives, health visitors, healthcare assistants, radiographers, janitors working in health, anyone who was working within the healthcare sector. But actually, what's been really interesting is I have been inundated with messages of people saying, wow, it's really helping me think about my own experience when I go into hospital or when I go to the GP or when I go to the dentist, and people who are just interested on the impact of trauma and adversity or stress on their body, on their sensory world, and starting to be used in that way as well. So, but yeah, I wrote it for health practitioners to hopefully try and support people to infuse a trauma, adversity, stress lens and some of the values and principles of trauma informed into day-to-day interactions and interventions, but also with an acknowledgement of how hard it is for services at the moment. You know, that actually we're working within stressed, pressurized, overstretched, under-resourced. There's so much staff burnout, compassionate fatigue, moral
trauma on both sides, right?
Absolutely. So how can we also help not just think it's not them and us? How can we support collective care, community care, and actually think about organizational culture within that?
Yeah. So obviously there's a kind of a broad introduction to what trauma-informed practice is and what it's like. But can you give us a few more specifics of the scope of the book and the types of topics that you're going to be covering in it?
Yes. Oh goodness. Now you're testing my memory. What people often don't know about writing books is from when you submit to when it actually comes out in shelves, it's a very long process.
You're allowed to look at the table of contents. You have a copy there, don't you?
No, I'm going to test myself. So I guess, yes, let me talk through a bit about the contents just to give people a flavour, and maybe I can go into the detail of a little bit. So the first chapter is literally introducing some of the different types of trauma and adversity and stressors, particularly because trauma is a broad umbrella term, and we know that there can be hierarchy around trauma, but also quite Western notions of trauma, and also quite narrow reductionist around post-traumatic stress disorder. So I wanted to give people a flavour of, we know some traumas are more visible or known and others are less acknowledged or more disenfranchised or minimized, or there's not a checklist or screening. So the first chapter is like introducing from intergenerational, transgenerational, multi-generational trauma, cultural trauma, medical health, birth, disability trauma, thinking about some of the different types of adversities like poverty trauma or the impact of discrimination or racism. So really thinking, and not just about, it's not the event, but about the experience, the meaning making, the sense making. And so the first chapter, in essence, goes through a little bit of an overview of different, you know, bullying, school-based abuse or workplace, helping people to think of a wider frame. So that's chapter 1. Chapter 2 and chapter 3 are really about what are some of the impact of trauma, adversity, stress on our bodies and on our health. And it's really wide-ranging from the in utero experience, a baby's first classroom, a baby's first lesson into life, into relationships, through to a bit about on our nervous systems, on our gut, from a gastro perspective. We've got Deepak here, who's one of the contributors, about pain. looking at some of the impact on our autoimmune systems, on our regulation and arousal systems. So how does trauma impact our body and our sensory systems? And then I go into, which is probably the hardest chapter, but I hope or think one of the most powerful, which is how some of the experiences can exacerbate or crystallize or activate or resurface. I'll send us down a chain of pain or a time hole of other experiences of feeling powerless or helpless or stuck or not having dignity. And so it talks about what abuse can do to our bodies, and then what it might be like going for a smear test or having an MRI or having your blood taken or having your weight commented on or having your legs in a stirrup or being naked in a chest gown or having someone rush you through in 2 minutes. And so it looks at what have some of our bodies, if our body could talk, what might it say? If our body, that trauma can be a multi-sensory experience, and really thinking about different experiences that can activate that within our services.
So you're really talking about those real life scenarios and very practical examples of where this can happen in day-to-day work.
Huge amount. And there's examples from such a range, from just off the top of my head, HIV, oncology, burns, dentistry, endocrinology, chronic pain, medical examinations, post-sexual assault. There's things there about weight management. I mean, there's so many different examples of how someone might feel, what might be activated, what it might be reminiscent, how it can stir up those trauma debris, trauma echoes, and really helping people to have what might that be like when you're coming into a hospital and the last time you were there, your parent died, or you had a stillborn baby, or what might that be like for someone to touch you in a certain way if previously you've experienced forced touch or experienced betrayal trauma. So it really goes into lots of details of that. And there's some interactive exercises as well.
And I mean, it sounds like, you've clearly done a lot of research and talked to a lot of people, done quite a bit of traveling as well. With all the kind of the work and the research that you put into this book. Did you encounter kind of individuals or organizations doing kind of good practice around this already? Because obviously with this book, you're looking to promote and encourage positive change. Can you give any examples of some of the kind of beacons of hope that you encountered along the way?
Yeah, absolutely. So let me just to sort of tie up the last bit slightly, and then I'll come back to that, because one of the chapters on that is, so after the body-based stuff, there's a whole chapter on organizational stress and organizational trauma and what it's like around staff well-being and wellness and feeling emotionally saturated, and as a practitioner, what it can be like feeling in a traumatized or trauma-soaked system. Then there's a chapter on cultural humility, which is my favorite chapter, that is around what's it like being someone in a wheelchair going into health services? What's it like being deaf? What's it like if you are blind? What's it like going into health services in a hijab? What's it like around the differences in medical racism, the difference in inequality? So there's lots around cultural idioms. Then it goes into the bit that you're talking about, Steve. So there is, what do we mean by trauma-informed values and principles? What are some of the kind of misconceptions around that? And then actually, what does this look like in practice? That every interaction is an intervention. And so I go through lots of examples of small things are the big things, but look at a tiny little thing we can do that makes a difference. And then I've got fantastic examples of best practice. We've got 2 people here with us today. We've got Lotta, we've got Deepak. We might have some in the audience, from burns to A&E to dentistry. We've got Christine Christina Wall, who wrote something on dentistry, to really share about what's made a difference to me as a practitioner and how have I managed to translate that, and how am I seeing the difference in adherence to treatment, and how am I seeing the difference in people's feedback and how we leave people feeling. So yeah, huge amounts about some of that. And then we end talking about sort of physical space and buildings and environments, because as we know, how the environment makes people feel. Yeah, just to sort of touch base, but yes, there are so many incredible practitioners who, against the odds, in really thorny, tricky environments that are feeling sometimes trauma saturated and oppressive. And, you know, we know in the NHS where some people might be struggling to have a toilet break or to get a mug or to get a pen. There's so much around amazing experiences of people who have really changed their referral forms, changed the letters that they send, how they send information. So there's been lots of those pockets of brilliance that I've interwoven throughout the book as well. So yeah.
And it sounds like sometimes it's just thinking about how you're communicating. It's not necessarily spending more money in order to create this change. It's just about having the ideas as you're designing things or as you're talking to people.
Well, I think that's the misconception sometimes. Of course, there's things that can cost loads of money, you know, training, certain resources, if you want an external consultant, thinking spaces. But so much of what we do is free. You know, one word can make a difference. The language that we use, the facial expressions, how we answer the phone, the posters that we have, how the toilets make people feel. There's so much around. We know the difference of when you go to someone and you feel seen, heard, that you matter, humanized, empathized, or if there's a long wait when someone comes and apologizes or said, I've held you in mind, or having access to water or having access to tissues, or, you know, so absolutely some of it is really, it's that dignity, it's compassion, it's person-centered, it's how do we make, it's that Maya Angelou, people often forget what you say, forget what you do, but my goodness, will they remember how you make them feel? So yeah, absolutely. It's not about having big fancy programs and lots of money. It's in those different interactions and about the organizational culture, you know.
That's good.
Oh, yeah.
So I'm going to play devil's advocate here. And I've got a copy of the book, and I'm sharing it with my colleagues in a kind of busy clinical practice, and they might be a bit stressed, quite overworked, and they're saying, you know, in an ideal world, I would do this stuff. It'll take a lot of time or investment. I'm just one person. What can I do? You know, my organisation hasn't necessarily bought into this. What would you say to, you know, readers who have kind of approached the book with some of those kinds of concerns and preconceptions?
That's a huge topic, isn't it? It's what I do so much training on. But I suppose first I'd start with, you know, honouring and acknowledging and respecting how tricky it can be to be a practitioner in a system that might feel traumatizing or traumatized or full up or overwhelmed. And sometimes that's where we get activist burnout, or we can feel powerless or helpless or stuck as to what can I do to make a difference. And so I think there's that real thing of how do we, you know, there's that quote, if you think you're too small to make a difference, try sleeping in the room with a mosquito. You know, I think each of us need to be hopeful disruptors and gentle disruptors and need to be change believers. And I think we might not be able to do all singing and all dancing, and that's true. Not every organisation will be able to be trauma informed. Not everyone's committed on that journey. But I think it is holding on to small things are the big things. Every interaction is an intervention. And pretty much everyone in this room will probably be able to think of one, two, multiple times that either was with a practitioner that you're like, oh my God, that was so gorgeous, or I felt so seen or heard, or that made such a difference in that 6-minute consultation, and probably will be able to think of the other, oh my goodness, I felt like a statistic or a conveyor belt. And I also think there's something about we have to evolve and develop. We're in a different context. We're in a different environment. We've got the ripples and the echoes of COVID, of Brexit, of closure of services, of privatization, that actually the most dangerous phrase in language is, we've always done it that way. And I think what's so interesting is if we think in a medical health term, we're asking people to take on advice or to make shifts or to adhere to a medication or to come for checkups. And we're hoping that people evolve and change and develop. And so we need to constantly be thinking. And I think we know the small things are the big things. But I just want to add, and it might be that some of the contributors say something later, so many people who have infused some of these values are like, God, it actually makes me feel so much more held or contained, or I feel like I'm being able to get more satisfaction or joy, or that I'm not re-traumatizing or doing harm. But actually, it's like if you use a smear test as an example, just a small tweaks not only can make such a difference to that person's experience, but what they say to their friends and family if they come back. And if people don't come back, we know that the ripple effect that can cause. So I think it's easier to prevent fires than put it out in that way that we say, or the time to fix a broken roof is when the sun's shining. And so I think we can sit with the frustration of, oh, I wish I could do more. And how do you find like-minded people? But actually, each of us, as I said, a word, a facial expression, and there's so many examples of that in the book, can make a difference. So I think it's thinking about, well, what bits can I do?
So those ripples almost are kind of a public health benefit as well. So it's not just about the medical care you receive when you're there, but it's about wider society's perception of what care represents. Yeah.
Huge. And people's relationship to help, to support, to authority, to power, particularly when so many people have experienced, relational trauma, betrayal trauma, institutional betrayal, that someone has often felt uncared for in a caring system. And so I think to be able to give a different experience, but absolutely it's those wider social justice, human rights, public health perspective that's so much bigger than just that day-to-day interaction, isn't it?
And to bring it back to the book again, that there are, if we're thinking about, ideas for embedding into practice, there are those kind of service level strategic kind of pieces in there. There's also the stuff around what you can do as an individual as well. So it kind of caters for whatever level you're operating at.
Yeah, that's what I was really trying to go with, because there's so many examples from people who use services. There's over 390 people's voices about what helped, what made a difference, what do they wish people knew. There's lots of the contributors who have given really tangible ways as to how they can change and shift. But yeah, there is really small things like how can you write a letter in a different way, and the language in a letter, to when you're in A&E, how do you have, more snacks when people water, through to what are we doing about, staff thinking spaces or staff well-being, or so yeah, there absolutely is. It's, multi-pronged to try and support different people at different stages and different levels. So yeah, absolutely.
So I was wanting to talk a little bit about the format of the book, because I mean, as with many of your books, it's quite visual, and it's quite, I guess they're quite kind of tactile visual objects, aren't they? The books and the packs of cards we've worked on together. Perhaps you could flick some pages as I'm speaking of the latest book. There's quite a few illustrations in there and infographics, and it's billed as a reflective guide as well. There's lots of reflective pieces in there. I was just going to ask you why you take this approach in.
So I'll just show people, there's quite a lot of sort of graphics and images like that. I hadn't pre-prepared this, so I'm literally just flicking through. There's different shades, which are actually different people's voices as to what they've shared. There is lots of sort of questions and reflective aspects. And then there's also lots of bits around I'm just trying to show different photographs and different images. So that's what Steve is sort of referring to for people who haven't seen my other books or references. Yeah, thanks for asking that, Steve, because I think Jessica Kingsley will probably know I'm quite specific about my formatting, and sometimes can be a little bit, no, I need more of this and I need more space, and no, don't try chuck it together. Because to me, there's something about modeling the model. And it's very easy to talk the talk, but it's how we walk the walk. How do we infuse and embody? I often use, the context, James Baldwin in the context racism says, I don't believe what you say because I see what you do. And so to me, I want the book to feel relational and humanizing, and to take people as much on a journey as possible. But also I know that learning, if you've just got chunks of text, sometimes it can feel quite or overwhelming. And so I wanted to almost do how I train, that there's a bit of thinking about, writing, but then there's, let's pause, I've got my little thing here. Let's take our brain to the gym. Let's reflect instead of react. What does this mean? How does it infuse? And then trying to have visuals, because we know a picture says 1,000 words, but different visuals speak to people or make people think about things differently. And words are often not enough, and we're activating different parts of our sensory system. So I think I really want the books to not just feel like an academic text, and also that people can dip in and dip out. So if I'm a busy doctor, I might just go to the chapter that I want on the values, and I might just read a couple of pages and then go back, and then I might take one of the reflective exercises and take it to a team meeting, or take it to a thinking space, or have a reading group, or come back, that it feels a bit more interactive and reciprocal, and it also creates conversations, because my hope is that it just plants seeds, and it's a comma, not a full stop, and that people can then take it and be like, oh, that was all stuff about burns and HIV, but how would I relate that to endocrinology, or how would I bring that into a pain context, and that it creates that continued conversation, really.
I think it's kind of interesting. So I've formerly, in a former life, I've worked for academic publishers, and it always amazes me that there's a lot of work and, a lot of kind of painstaking thought gone into creating books quite often, but very little thought on the actual execution and how people are going to read it, and what's the best way to encourage a creative reading of that material too. So that's a really, really big part. And I think a lot of the time for writers, often specialist writers who are very close to the subject, and so having a very deep sort of knowledge of that subject, they don't all go to that second step of thinking, how do I liberate this information? How do I set it free and let other people run with it?
Yeah, I like that word, liberate, as well. Thanks, Steve.
You
also made me, you made me think about the cards. So let's do a plug for the cards, everyone. This is my trauma deck of cards, everyone. They're quite big. But if anyone's not familiar, there is an online module, there's brochures, but I have to say, if I was to say two products that go perfectly together, it is the two, Trauma Deck and the Trauma Informed Health, because there are so many different ways, versatile ways you can use them, but really talking about different signs, signals, experience, feelings about trauma, stress, grief, adversity, but using visual, expressive, creative, not relying just on words, and so many ways that we can use it for psychoeducation, for intervention, for information gathering, for our own self-reflection. So yeah, just to sort of bring that into the ether for people who aren't familiar of them as well. So yeah.
Thanks, Karen. And I'm mindful of needing to keep some time over. I think we're due to finish at past for questions. So I just have one final question for you, really, which is the impact that you hope the book will have on our current healthcare system, or perhaps, less grandly, what you hope readers will benefit from. Ideally, every healthcare worker will buy it and it will transform the system. But, what are your hopes for the book?
I'm only laughing because Steve knows, you know, I like to think big and be a mover and a shaker and all the rest. So yes, my hope would be that every health professional would read it, and that it would particularly be for universities and students and all the rest. But honestly, I've been moved to tears several times this week, and it's been quite unbelievable. I've been messaging Sandra about it, and just from people who are messaging saying, oh my goodness, I so see myself reflecting in this book, or I can so see some tangible things that I can do to change or improve practice, or wow, I've been doing this for 30 years and I've just noticed there's literally something I can just tweak or supercharge that might be something different, or wow, I had someone respond in that way and I'm going to be curious instead of furious, or see a person differently and you see a different person. And I think the thought that someone will go into a healthcare situation and have a different feeling or experience, but also for people working in health, you know, that actually that they feel that collective care, that community care, it's not us and them, that we're thinking about staff well-being and wellness. So yeah, my huge hope is that it gives people some ideas and some golden nuggets to just tweak and enrich and improve the incredible work that's already been done, and that hopefully we can try and reduce some of the unintentional harm or trauma-inducing experiences through system trauma or iatrogenic harm. Would be my
about making that real life change to kind of daily practice. Yeah, fantastic. Thanks, Karen. That's brilliant. We've got 10 minutes remaining to hear from everyone else who's in the shared space. So Sandra, what's the kind of, do you want to lead this section in terms of the questions?
Yeah, sure. I'll drop in any questions. So we actually have a question from Karen Hamilton, who asked, how do we change how healthcare professionals interact when they do not see the tone or how they communicate with patients? She's also gone on to say just a couple of other things. To them, this is an everyday problem, but for the patient, this is frightening in their first time. And then she mentions that her daughter is a student nurse and there's no mention of trauma and thinking in how to interact with people.
Yeah.
So I can repeat the first bit again if you would like to.
Don't worry, I think I got most of that. I probably will, this is a bit of a whistle stop, isn't it? And I probably won't be able to offer a huge sense, because that's kind of what I do, training and space. And Karen, maybe that's something we can do in the conference, because I'm with Karen in a conference in Northern Ireland in a few months. I'm also mindful we've got a couple of contributors who might want to say or share any bits. I think, Karen, that quite a lot of that is there's two prongs. One is about organizational trauma and system trauma. Brains in pain can sometimes struggle to think. It's really hard to be mindful when our minds are full, and when we're on autopilot, or when we've had to do protective dissociation or go into empathetic shutdown. And so I think part of that is about staff wellness and staff well-being and organizational culture, because when someone has had to numb or dehumanize or shut down, how we help to start to connect with that. But the other bit about that is to help people to connect. What would that be like if that was my mum or my sister or me? Or what might it be like on the receiving end? And also to sometimes be able to reflect instead of react, to be able to have a sense and experience, to be like, goodness, I can make a difference, and to have some tangible ways of being able to do it. But I'm with you, there should be so much more in courses and in your daughter's course and all the rest. So that's my little aspect around that. Can we just check, particularly, I don't know if Deepak or Lotta, if there's anything you wanted to add or share or bring to the space before I look at some of the other questions. Hello.
Hi. Can you hear me?
Yes. Yeah.
Brilliant. Well, first of all, Karen, congratulations. I received your copy of the book just a day before I went off on my holiday, and I've just come last night, so I haven't had a full chance to go through the book. But I did look at my section, and I did see what I contributed, and really the chapters and the layout is really well done, and I'm really hoping to dig my teeth into it over the next few weeks. What I did want to say to all your audience and coming from a trauma-informed perspective and trying to implement that. I'm a full-time NHS consultant working in a secondary care pain clinic. And as many of your listeners would know, chronic pain is one of those conditions where the sufferer has had their own share of trauma, from being not believed by their own near and dear ones sometimes, to the trauma they experience as they go through their patient journey at all the touch points they encounter with healthcare professionals spread across primary, community, and secondary care. So I think just taking that time to reflect and being aware that what I speak to them, how I speak to them, recognizing that I am looking after a hypersensitive and overprotective nervous system, and therefore, what are all the aspects of communication and interventions that I do has and can make a difference. And maybe just as a point, just by being a little mindful, and you're absolutely right, when our minds are full, it's difficult to be mindful there. But over the last 6 years, what I can say is that by trying to deploy those aims of trauma-informed practice and trauma-aware practice in my communication, I've not received, touch wood, any complaints about my care. I prescribe opioids. I help patients come down on opioids. These are all very difficult decisions which can, if not communicated well, can result in patients feeling upset. And touch wood, I've not had that experience. So I think it's a very necessary and important part of a clinical practice. The only other point I will add to this whole thing is that we are in healthcare, we are at that first stage from my interactions, is where a lot of people aren't even aware. So I think your book and the fact that you've got a community here and everybody's listening, our first roles as healthcare professionals is to just raise awareness that this is a common problem that needs to be addressed at all levels and to be talked about openly, like the way we have stigmatized mental health, and now we are not stigmatizing mental health by openly talking about it. We need to be aware that trauma is something that can be a shame, and we need to first of all normalize it in some way by talking about it. And I think that's the first step. Once you do that, I think there are opportunities in every aspect of healthcare to improve. And I think you've highlighted a lot of those opportunities in your book. So thank you so much for having me as a contributor, and thank you for such a good resource. Well done and congratulations.
Thank you, Deepak, and thank you for everything you are and everything you do. Deepak is doing some phenomenal work, and he's scraping the surface, as we all are, because of time, because his contribution says, and his email's there to also get in touch, because there's so many other amazing outcomes that he has had in his clinic and in his space. So yeah, absolutely. Thank you. I'm not sure if there's any, I'm mindful we've only got a few minutes, time's going so quickly, but Lotta, was there any kind of little bits you wanted to share and say?
I'm doing the same. I'm looking at the clock, and as Karen knows, I tend to be rather understated. So if I say anything positive, it's very positive. It's such a welcomed book. I think you've done an amazing job. I've already bought so many copies and sent them to so many people working in healthcare. I think it's an absolutely essential book. And I think what you've done really well is not create a split. I think, as you say, you know, I work in acute pediatrics, but before then I've worked for about 20 plus years in trauma and hadn't worked in healthcare setting. And I think coming into acute pediatrics, it was a surprise to me, I think, how easy it is, understandable, but easy it is for people to be working in very traumatizing systems, and for their cognitive capacity to get to the point where it's easy to think this is someone else's job. We can't kind of do this ourselves. It's a specialist area, trauma-informed practice. And I think what you've done is written a book that's really understanding of the system, but also makes it not scary. It makes it everybody's job. And I think it's very rich in theory in terms of people taking it seriously, but it's, you know, taking into account all of those real life experiences. And it's got really nice, pragmatic, easy to pick up and dip into for busy clinicians, ideas and resources. And I think it gets back to the human side of why everyone got into practicing in the first place, which is because they care and they want to reduce distress and dis-ease. That's why people wanted to get into the roles they wanted to get into. And I think the faster the pace, the less resourced, particularly the NHS is, the more demand there is, the higher acuity there is, the harder it is to think about. And I think what you've done is delivered something that's so rich in theory and so wide in thinking, the lens of trauma, but also makes it simple on the other side in terms of saying this is about getting back to being human, it's about caring, and it's about being really overt at how we treat people. And I think you said it can be very difficult to, we can't always have all singing, all dancing, well-financed things. Sometimes we can, sometimes that's harder. But even when practice is poor, people do get complaints, which they will do in times like this. It's about saying, I'm really sorry, that wasn't good enough for you, and talking to people as if they're valued people, and that can go a really long way. So I think it's very human and really optimistic at a time where practitioners also need that hope and reminder about why they got into their roles in the first place. So I've already shared it with some people and had such lovely feedback, which I will pass on to you. And I think it's really going to change people's practice. So thank you.
Well, thank you. You're making me tearful. And people who don't know Lotta, she is one of the most understated people I know. So I'm quite blown away by those comments. So thank you, Lotta. I'm so mindful it has come to time. I haven't even got a chance to read all the comments, so I'm going to read each and every one of those. And hopefully we'll have time to interact with people on social media. And this is just the conversation and a comma, not a full stop. So I don't know, Steve or Sandra, if there were any final bits, but I just want to say a huge thank you to Jessica Kingsley for all the support, for all the people you don't see, to Sandra, who's just a superstar, to Lotta, to Deepak, and to all of you. I really hope this is part of a conversation to make practice different. So thank you, everyone.
Yeah, thanks everyone for joining us tonight. It's much appreciated. And I think, Sandra, you're going to send a kind of a follow-up message to everyone who's joined. So again, if anyone has any questions for us to follow up, do get in touch. I'm on social media, or it's hello@jkp.com, and it'll get to me. Or to Sandra.
Yeah, I'll send a follow-up email, everyone. It will have my email address in it. So yeah, I'm really sorry if we didn't answer all your questions, but if you still have those questions, don't worry, you can email me and I can forward them on to Karen, and there'll be a discount code coming, and there'll be a link to the book and where you can purchase it, and also a link to the recording. But thank you guys so much for joining us.
Brilliant.
Thank you, everyone. Big virtual hugs. Thank you.
Bye.
Appreciate it. Bye-bye. Thank you.
Bye.